Hello, I would like to cover some abstracts which we have today chance to see and to discuss here at the Atlanta at ASH 2017. During the oral presentation there were a couple of the abstracts which updated the results already published in the first line or second line, and there is some abstract which has been presented for the first time and is going to be published. I would like to start with the elderly population because there is one old study for the elderly population which was run by the European Mantle Cell Lymphoma Network and already published in 2012 in the New England Journal of Medicine. And it has demonstrated that the patients who received the R-CHOP followed by the rituximab maintenance have significantly better progression-free survival compared to the patient who received only interferon alpha maintenance. And in today's presentation, Eva Hoster and its abstract 153, she described the updated data, and I have to tell you that it's already the overall survival benefit for these patients who were able to come to the rituximab maintenance and who were treated in the rituximab maintenance arm. This is a very important piece of evidence. And I would like just to remind another abstract which is presented in the poster session. It's a Czech lymphoma study group abstract, the number 1498. And this abstract is describing real-life data of the patients who were treated with the rituximab maintenance. And what we are showing that the patients who are able to finish the maintenance have a very good outcome in terms of the overall survival. But the patients who failed rituximab maintenance, they have a poor outcome, and they are candidates for the second line or third line treatment and newly used drugs. And we have now chance to treat the patients with the Bruton tyrosine kinase inhibitors. And Simon Rules in the abstract 151 described the update and the pooled analysis of the 3 studies of the patients treated with the ibrutinib. And the main topic, main focus, he focuses on the differences between patients who were treated in the first relapse compared to the patients who were treated after 2 or more lines failure. And there is the significantly better outcome for the patients treated earlier, it means in the first relapse. But I would like to notice that from my point of view, the analysis should be done from the time of the first relapse, because then you lose the overall survival patients who have one more lines. It means you have 2 starting points, but it's very good abstract. Today's for the first time was presented the acalabrutinib data, which are going to be published in the Lancet very soon. And acalabrutinib is the other BTK inhibitor, and it has been shown it's very effective with almost 90% overall response rate and very high complete remission rate. And from the data we have seen and we have discussed, it seems that the toxicity profile is very good. And finally, there was an update of the first-line treatment combination of lenalidomide plus rituximab. And again, the outcome of these patients is very, very good. And it seems that these combinations could equalize in the first-line treatment the high-risk MIPI compared to the low or intermediate risk MIPI. So, in the summary, I think that we have been informed and confirmed that the use of the rituximab maintenance is really very important piece of our standard of care, and that we have chance to use the BTK inhibitors and some other drugs in the second line. But still there is a question how to sequence these new drugs, lenalidomide, ibrutinib, acalabrutinib, and in the future hopefully venetoclax. So it was exciting to see and to hear new data about the mantle cell lymphoma.